Let's talk about human anatomy, specifically anatomical terminology. This series of instructional videos on human anatomy needs to start with really where any anatomy course needs to start, and that's with terminology, directional terminology or anatomical terminology, so we can describe body parts, body regions, or the overall body to another individual. So I can describe it to you via these online videos. These terms are used in textbooks, so everyone can have the same proper perspective and orientation with understanding the verbiage. So that's going to be the goal of this video and subsequent videos within this series on human anatomy. Okay, so the first place to start is standard anatomical position. And standard anatomical position is displayed with this image right here, with this individual facing us, feet facing forward, the palms of the hands facing forward, the arms at the sides. As we see, the thumbs are out to the sides. They don't necessarily need to be out to the sides. Those thumbs could be pointed towards the ground. But this is standard anatomical position. And in standard anatomical position, the image, the individual, the specimen, the organ is facing you like an individual would be facing you as they are talking to you. If the palms of those hands are facing posteriorly, this individual would no longer be in standard anatomical position. And this position is really important because with these subsequent terms that we are going to use, it's all based off of this position or based off a standard anatomical position. So with standard anatomical position, you need to envision the individual facing you. And if we're talking, for example, just about the liver, which I'll show you in a moment, if it's an isolated liver, you need to consider that individual is facing you. And I need to preface that or offer a caveat to that, that you need to assume it's in standard anatomical position unless it's designated otherwise. And if we're not looking at anything, and if something is being described, we are assuming it's in standard anatomical position. So once again, standard anatomical position is the individual or organ or body part facing us, palms facing forward, feet facing forward. With that said, if we look at this hand right here and we are facing that image, that is the right hand, and that is fairly intuitive to understand. But when we are looking at an organ or body part, once again, assume what is your left is the organs or body part's right. That is to say, that individual organ or body part is facing you as you're viewing that, or facing you as you're imagining it in your mind as you're reading some excerpt about human anatomy. The top of the body or top of an organ or top of a body part is known as superior. The bottom is known as inferior. So the most inferior aspect of this image right here are the feet. The most superior aspect of this image is this part of the hair right here. One very important thing I want to highlight is when we are talking about terms like superior and inferior, and subsequently we'll talk about anterior, posterior, medial, and lateral, these are relative terms. That is to say, by and large, we don't use these terms in isolation. That is to say, if we look at the nose right here, it doesn't make sense to say the nose is superior. Now, certainly, the nose is superior to most things in this body. It's superior to the mouth, superior to the chin, superior to the shoulders, so on and so forth. But the nose is inferior to all of the hair, maybe with the exception of the sideburns right here. So if you're going to refer to the nose, you would need to say the nose is superior to the shoulders or superior to some other body part. Most things in the body or an organ can be used, both terms can be used for the same body part. For example, the nose is superior to the shoulders, but the nose is inferior to the eyes. And that's what I mean by relative. It's relative to other structures or parts of the body or organ. Now, to be clear, we could say the superiormost region or the superiormost aspect. But if we're just using the term superior, we need to relate it to another body part. And that's going to be the case with all of the subsequent terms we're going to talk about. Okay, so here's superior and inferior again. Superior is towards the top, inferior is towards the bottom. Okay, so let's just look at this image right here just to review superior and inferior. So this individual is in standard anatomical position. Granted, we don't see this individual's hands or palms of their hands, but let's just assume that they are in standard anatomical position. The eye is superior to the nose, but the eye is inferior to the eyebrows. The wrinkles up here on the forehead, the wrinkles are superior to the eyebrows, but inferior to the top of the head. The neck is inferior to the lips, and the neck is superior to the feet. So once again, always use these terms in relation to another body part or structure. Okay, another set of terms are anterior and posterior. Anterior is towards the front of the body or front of an organ. Posterior is towards the rear. Once again, these are relative terms. Now, if I'm pointing to the tip of the nose, I certainly could say the tip of the nose is anterior because there is absolutely nothing that could possibly be more anterior than the tip of the nose, at least in this image. Certainly, the toes in standard anatomical position of a human being are probably going to be more anterior than the tip of the nose. But in this image right here, the tip of the nose is anterior to anything else in this image right here. But the eye is posterior to the nose, and the eye is anterior to the ear. So once again, we can use both those terms for the same structure. Anterior is towards the front, posterior is towards the back or towards the rear. Okay. Now we are going to talk about two terms that frustrate me to no end with regards to human anatomy. And the terms are dorsal and ventral. Dorsal is used synonymously with posterior, and ventral is used synonymously for anterior. That is to say, one could say dorsal when one means posterior. One could say ventral when one means anterior. In theory, they mean the same thing, but I personally think, keep in mind, no one has asked me my opinion on this, and that's why I'm going to give it. I personally think using dorsal and ventral within the realm of human anatomy is silly, because dorsal and ventral are typically used for horizontally locomotive animals. That is to say, a quadruped like a pig or a fish like a shark. So if we look at the fish, or excuse me, if we look at the pig right here, this is the belly, and this is the ventral region of this pig. This is the back. This is the dorsal region of the pig. Now keep in mind that this part of the pig is anterior, this part of the pig is posterior. So dorsal and ventral do not work synonymously with anterior and posterior when we're dealing with a quadruped or something like a fish. Now, I realize that the head of the pig has turned laterally to face us here, but just assume that pig is facing forward. This would be anterior, but it is certainly not ventral. Ventral is the belly region of a quadruped, or the belly region of a fish. Dorsal is the back. And in this case, with a quadruped or a fish, the dorsal region is synonymous with superior, and ventral is synonymous with inferior. The same thing with a fish. This is the ventral region or belly of the fish, and this is the dorsal region, hence the name dorsal fin. And because humans are habitual bipeds that locomote on 2 feet vertically, it makes really no sense to use the term dorsal and ventral, with the exception of one region of the human body, the one region of the human body that is generally horizontal, and that's the foot. When the foot is flat on the ground, it is horizontal, and the top of the foot would be the dorsal surface, and the bottom of the foot would be synonymous with the ventral surface. And once again, the top of the foot, which I just described as being dorsal, is the superior aspect of the foot, and the bottom of the foot, the ventral surface, is the inferior aspect of the foot. Now, just a quick side note, the ventral surface of the foot is really generally referred to as the plantar surface of the foot, but we'll talk about that in more detail when we get to that. But the foot is the only aspect of the human body that is horizontal, akin to the horizontalness of a pig or of a fish. And that is why I think, personally, no one asked, that dorsal and ventral should not be used in human anatomy. But it is. So that's why we need to know that within the confines of human anatomy, dorsal is the same thing as posterior, and ventral is the same thing as anterior. We will talk about a dorsal body cavity and a ventral body cavity in a subsequent video. Okay, so let's talk about a couple other relative terms, and these are medial and lateral. When we think about medial and lateral, we need to imagine a line going right down the middle of a body or right down the middle of a body part or organ. And that would be known as the midline. Medial is any part of the body or any part of an organ or structure closer to the midline. Lateral is the part of the body or organ or structure furthest away from the midline. So in this image right here, the left eye, keep in mind, I realize this is on the side of your right hand, but that is this individual's left eye. The left eye is medial to the ear. And what that is saying is the left eye is closer to the midline than the ear is. The left eye is lateral to this part of the nose. And I realize this midline is going down, not really the middle of the nose, but let's just say this part of the nose right here. The eye is lateral to the nose. We can do the same thing with the shoulder. The shoulder is medial to the thumb. But the shoulder is lateral to the eye, meaning the shoulder is further away from the midline than the eye is. We could do the fingers. The index finger is medial to the thumb, meaning the index finger is closer to the midline than the thumb is. But the index finger is lateral to the pinky finger or the little finger because the index finger is further away from the midline. Medial is closer to the midline, lateral is further away from the midline. And once again, these are relative terms. It makes no sense to say the right foot is lateral. You have to relate it to another part of the body or organ or structure. Okay, superficial and deep are another pair of relative terms. Deep is within the body, away from the surface. Superficial is towards the surface of the body. So if we look at this chubby little baby here, it has skin. Underneath the skin, there's going to be a lot of fat. Underneath the fat, there's going to be muscles. So within that, we have skin, fat, and muscles. From superficial to deep, skin, fat, and muscles. The fat is deep to the skin, suggesting that the fat is closer to the interior of the body than the skin is. But the fat is superficial to the muscles because the fat is closer to the surface of the body than the muscles are. Superficial and deep. Superficial towards the surface, deep away from the surface, or towards the interior of the body. Okay, Proximal and distal. And proximal and distal are arguably the two most challenging terms within this nomenclature of relative terms. Proximal describes a body part that is closer to the point of attachment or closer to the torso. Distal is the part of the body furthest away from the point of attachment or from the torso. So if we look at the left arm right here, and if I put a line right here, that line is proximal to the wrist being down here. That line is closer to the point of attachment where the arm attaches to the torso than the wrist. So we would say that line or marking or muscle in this region, let's say it's the triceps brachii or the biceps brachii, that line is proximal to the wrist. We could say the elbow, which would be right here. We don't really see an elbow in this image. The elbow is proximal to the wrist. Accordingly, we would say the wrist is distal to the elbow, which is suggesting that the wrist is further away from the torso or the point of attachment than the elbow is. We could do the same thing with the knee and the ankle. Granted, we don't really see a knee and the ankle here, or it's not well drawn or depicted in this image. But the knee is proximal to the ankle. The ankle is distal to the knee. Proximal and distal. Proximal closest to the origin or attachment, distal furthest away from the origin or attachment. Now, I will use proximal and distal for other structures within the body. Generally, we use it for the limbs. Here we have a femur, specifically a right femur. This is the head of the femur, which articulates with the pelvic bone known as the os coxa, and more specifically with a region or part of that pelvic bone known as the acetabulum. So this is the head of the femur. This is the bottom of the femur, the inferior most aspect of the femur. This is the patellar surface, medial condyle, lateral condyle, so on and so forth. This is the inferior most aspect of the femur. This is the superior most aspect of the femur. This structure right here is known as the greater trochanter. My point here is not to teach or have you learn parts of the bone at this point, but I'm just articulating or I'm just mentioning these names so we can describe where they are in relation to each other. And actually, let's use this structure right here, which is the lesser trochanter. The lesser trochanter is distal to the head of the femur. The head of the femur is proximal to the lesser trochanter. We could also say the lesser trochanter is proximal to the patellar surface, and we could say the patellar surface is distal to the lesser trochanter. So one point here is we could use different terminology for the same thing. We could say the lesser trochanter is superior to the patellar surface, which it certainly is. Or we could say the lesser trochanter is proximal to the patellar surface. And that's describing the same spatial relationship. Now, to be clear, I will use proximal and distal with things other than appendages, the arms, the legs, femur, tibia, what have you. If we look at the uterus right here, just directional terminology, this is the superior most aspect of the uterus. This is the inferior most aspect of the uterus. And coming off the uterus, we have the fallopian tubes, also known as uterine tubes or oviducts. But if we follow the fallopian tube from the uterus and move laterally away from the midline, so keep in mind there'd be a midline going right down the middle of this uterus, I could say this region right here of the fallopian tube, the ampulla, is lateral to the isthmus of the fallopian tube, which is this region right here. It's lateral to the isthmus, and don't worry about these specific terms. Let's just say this region of the fallopian tube is lateral to this region of the fallopian tube because it is further away from the midline. But I could also say, and I do say this at times, that if there is a sperm cell in this region of the fallopian tube, I might suggest it's at the distalmost end of the fallopian tube. Now, granted, fertilization would probably occur somewhere closer to the uterus within the fallopian tube. Those details are not important for this, but my point is that I may use proximal and distal when I'm focusing on a tube such as the fallopian tube or the oviduct. Sometimes I would even use it for a neuron. A neuron is a nerve cell that looks something like this down here. Maybe not so much, but we have dendrites, axon terminals right here, and the conduction along a neuron, the movement of the electrical impulse moves from the dendrites to the axon terminals. It's not necessarily from left to right. I have it drawn left to right, but I may describe this as the distal end of the neuron because it's further away from where all the activity starts. This right here is the body, so I would say it's further away from the body. This region right here is more distal than this region right here because this region right here is closer to the body of the neuron. I also may use proximal and distal when I'm talking about the intestines. So if we look here in pink, this is the stomach. Leaving the stomach, we have the small intestine, which includes the duodenum in green, the jejunum in blue, and the ileum in red. The ileum is the distalmost parts of the small intestine, meaning it's furthest away from the stomach. And this only makes sense if you understand that contents within the small intestine are moving this direction, further away from the stomach. Or I could describe this region of the ileum as the distalmost aspect of the ileum, understanding that this is where the ileum starts and that's the beginning of it. So I would say this is the distal end. Generally speaking, with distal and proximal and distal, we use it with appendages, but like I've just elaborated, I may use it within other structures or tubes in the body. To be clear, the nerve cell or neuron is not a tube, but I still could use proximal and distal with that. More so distal than proximal. Okay, so the last set of words or terms I want to focus on are what are known as sections or planes. And these are methods or ways an organ, body part, or the whole body could be divided, either literally divided, cut up, or theoretically so we can understand things. The first one I want to talk about is a sagittal section, and a sagittal section divides the body into right and left portions. Now, we could have a mid-sagittal section, which is going right down the middle of the body, exactly right down the middle, which would divide the body into perfect or equal right and left halves of the body. This right here is known as a parasagittal section because it is deviated or offset from the midline, but it is still dividing the body into right and left portions. Granted, they are unequal in size. We also have a transverse section, which is also known as a cross section. It is a horizontal plane that divides the body into superior and inferior portions. Once again, this line could be anywhere. We could have the line across the face like this, where we now have a smaller superior portion and a larger inferior portion. So a transverse, otherwise known as a cross section, divides the body into superior and inferior portions. And lastly, we have what's known as a frontal section, also known as a coronal section. And a coronal section is going to divide the body or a part or organ into an anterior portion and a posterior portion. And that's the beginning of this human anatomy series. Once again, anatomical terminology needs to be our first order of business or understanding so we can talk with each other and describe things with each other either by voice or in writing.